Hello, ladies and gentlemen. Welcome to another edition of Isham Health Tip. My name is Ewuke Ishamoni, and recently we have been having a national problem, a national health concern, which is the recent cholera outbreak. I'm here to bring you guys an insight on the disease cholera. Cholera is an acute diarrheal intestinal infection. It is caused by a toxigenic bacteria called Vibrio cholerae, and if left unattended to, it can lead you to dehydration, which can also progress into shock, which is a deadly situation, and if left unchecked, can lead to loss of life. What are the signs and symptoms of this disease? Firstly, you are going to experience severe diarrhea. Second of all, you are going to experience vomiting as well, severe vomiting which comes along the diarrhea. And then, aside from that, you're also going to experience maybe some leg cramps, which are also common, and low abdominal pains, which are common with severe diarrhea. Those are things you might experience. Now, when this progresses, it will lead to dehydration, and you are going to notice the person start showing signs of dehydration, like the person will have sunken eyes, the person will lose skin tone. It means the skin will not more be smooth like mine, like this. It's going to be a little bit twist and stuff like that, showing that there is reduced fluid in the person's body. The person is going to also have dry lips and many other signs of dehydration. And this is also going to lead to what we call shock, which is a deadly condition if left unchecked. So if you don't attend to that dehydration, it's going to result to shock. So most of the times, if you notice early signs of cholera, you have to take measures to take the person to the hospital immediately so that they can start putting the person on the right treatment for cholera, and you can give the person the first aid at home of oral rehydration solution to help replace those lost fluids so that the person does not go into the state of dehydration. Okay, so how can you get cholera? Cholera is not transmitted from person to person most of the time. So of course, you can have it from somebody who has it, but that is not mainly a risk factor for it. Cholera is mainly gotten from eating contaminated food and water, contaminated by the bacteria Vibrio cholerae. Then you are going to have the disease. Why cholera is so dangerous and why it spreads so fast is because if one person has the disease in an area where there is poor sewage disposal, the waste place is dirty, then their water supply there is not safe. When that person defecates or vomits, that bacteria can travel to that water source, and then the other people drinking that water source will have cholera disease. The same with feces. Flies and other vectors can land on the feces, carry the bacteria, and bring on your exposed food that you leave and you don't cover. So when you leave food uncovered and all those kind of things, those are things that can lead you to have cholera. So how can we prevent this disease? You can prevent cholera first by making sure that your water supply, your water source is good. Drink clean potable water. Secondly, eat hot food. You understand? That warm your food each time you want to eat it, and do not leave your food uncovered. Don't leave food exposed. Keep your environment clean. Your place where you keep water for drinking should be clean. Sanitary conditions around your house and with your family and everybody should be clean, and make sure that you do not give room for flies to land on any of your food or whatever that you eat. That will help prevent you from having the disease. If your food and your water is safe, then you are definitely safe from cholera. Now, how can you help yourself if you find yourself having this disease? If you see somebody having severe diarrhea, vomiting, how can you help the person at home? You have to prepare the person what we call an oral rehydration solution, ORS. I'm sure most of us here know about ORS. You can prepare it either by buying the ready-made sachet which they sell in pharmacies, sell in places. You just come and pour into a bottle of water and mix, or you can prepare yourself at home by mixing a salt and sugar solution and then you drink. That will help replace fluids and electrolytes that have been lost as a result of severe diarrhea, and that will prevent you from having dehydration and in turn prevent you from shock. So how can you prepare this ORS solution at home? If you have the powder sugar, then you have to take 6 teaspoons please of the sugar, mix in a 1 liter of water, and then you take a level spoon of salt and mix in that liter of water. If you have the cubes of sugar, then you take 8 cubes of sugar and mix with 1 level spoon of salt in 1 liter of water. That's how you prepare your ORS solution. That ORS can help treat the patient. But like I said, cholera is a bacterial infection, so you have to tackle the bacteria with specific antibiotics. So while giving the person ORS, and then you take the person to the hospital and they'll put the person on the specific antibiotics that target Vibrio cholerae, and the person is going to be free. Cholera can be treated and it is not a death sentence. Okay, so that's all we have for you today, and I want to say that continue to stay healthy, and everybody who follows the channel, you're free to DM and we can always discuss your health problems one-on-one with our health experts. You are always free to respond. And those that have DM and the responses have not yet complete, just be patient. Everybody is going to be responded to. Thank you very much. My name is Oke Shamone and I am signing out. Keep following Sharp Health.